Welcome everybody. Thanks for coming to this evening's webinar. I'm Chris Jones. I'm the founder of HosPortal, and I'll be telling you today about AI and the future of rostering and showcasing our new AI rostering feature that we'll be rolling out in coming weeks and that we've spent just under a year developing. So who is HosPortal? I know not everybody here is a current user of HosPortal, so we're an Australian company, experienced medical clinicians like myself. I'm an anaesthetist. I still work in clinical practice. I've got an operating list tomorrow. A very talented team of software engineers who help us build the software you're going to see today, and commercial executives who run our company. And we're focused on improving the lives of doctors and healthcare administrators by building really brilliant software that makes their life a lot easier and that they love to use. All of our software is 100% cloud-based and is very easy to set up and get using straight away. How big are we? Well, we have more than 80 sites across Australia and New Zealand, covering a range of craft groups, public and private hospitals, anaesthesia, surgery, medicine, imaging, junior doctors, to name a few. And we currently have more than 10,000 users, some of whom benefit from our cross-site design. That means users can see multiple hospitals from a single login. We're constantly improving and updating our software, predominantly in response to requests from our clients for new features. And we're always trying to build the next best thing to make sure we're ahead of the curve. And what you're looking at today, our AI is part of that. And over the last 12 months, we've released over 500 new features as part of 16 separate releases. So here's a quick summary of what I'll be talking about this evening. First of all, I'm going to talk about rostering generally and constraints, and we'll talk about what constraints are and a little bit about how HosPortal allows you to set up these various parts that are needed as the workflow of building a roster. Because as I mentioned earlier, not everyone here will have used HosPortal and be familiar with our systems. And for those of you who are, you may come across some features that you haven't seen already. Then I'm going to talk through the algorithm that we have been using for the last 10 years for building rosters, what's really good about it, but where it's not quite as good as we'd like it to be under certain circumstances. Then we'll talk about what our AI does and why it's better and different to our existing algorithm. I'm then going to run through a series of examples where we'll be building rosters, most of them not in real time, as I'll explain, using the AI. And then after that, a little bit of the future directions for HosPortal over coming months. So let's start with rostering and constraints. As I said, I'm going to go through some thoughts about what rostering is, and then look into the components of HosPortal that we use as part of the workflow for both our existing algorithm and also for the AI in order to build rosters. So rostering, nobody likes it. It's difficult, it's hard, it's frustrating. In the clinical environment, it frequently involves medical practitioners because they have the special knowledge and information required to do it well. They may know the doctors well. They may know the particular roles and what the requirements are, and therefore they're taken away from clinical duties. And it's critical for patient safety. But what is it about really? It's about filling shifts versus constraints to fill those shifts. Now, it'd be trivial to write rosters if, for example, you didn't care if there were vacant shifts, if you didn't care that there was nobody working in the ER at 2 a.m. It'd also be trivial if you didn't have to worry about the constraints, how often people work, when they work, how many hours a week they do, or whether they're on leave. But when you've got those things together, that's what makes it difficult. So HosPortal allows you to first define what your rosters are. So what days of the week do shifts fall on? Do they fall on public holidays? When do they start and end? Informed by our long exposure to the medical environment, we also allow quite a lot of nuance in who can do a shift. So for example, what role they have, what skills they may have, what team they may belong to. We have two main workflows for building rosters, self-roster and auto-build. And these, for self-roster, users can have some say in the construction of the roster, either by specifically selecting shifts, making preference for shifts, and also making blockouts or days that they don't want to work, whereas auto-build doesn't have any user input. Both of these will specify which shifts you're aiming to fill as part of a particular workflow, who are the users that are going to be filling these shifts, and then those shifts can be grouped together to apply quotas to them. So, for example, maybe you want to ensure fairness across night duty and day duty, or weekends and weekdays, so you can group these together in quota groups. And you can also then assign priorities as well, and we're going to see that today, how, for example, you might put a higher priority on night duty to make sure all of those shifts are filled, and you care less a little bit about where the day shifts are filled. Now, these are the constraints that I sort of briefly touched upon. So we've got users leave. We have work rules, which may be things like award requirements, such as perhaps how many hours people work over a time frame. Maybe it's a pay period, how many hours people can do in a pay period. Could be something like people aren't allowed to work more than 5 consecutive days. We have what we call our conflict rules, which are a definition of how 2 shifts that a user does must be related or not related. So, for example, you might specify certain types of shifts can't overlap or need a certain space between them. You might say, for example, if someone's done a night duty, they're not allowed to do any shift on the next day. Then there's preferences, and we have a workflow for users to make those preferences, both positive and negative, the negative ones that we call blockouts. The constraints also include vacancies. As I alluded to, you may have different priorities for which shifts are more important to be filled than others. And lastly, and this is something that is unique to the AI, is the ability to fill patterns. We'll go into this in more detail, but something like users might do 2 morning shifts followed by 2 afternoon shifts, followed by 2 night shifts, followed by 2 days off. And the same person needs to do all of those shifts, and the AI is able to use these patterns to build rosters. So let's look at quickly how HosPortal does these things. So with respect to leave, users can request leave online through HosPortal. You can have a number of rules to automate that process. For example, automatically approving leave under certain circumstances, denying it under others, or putting it into a pending state where a relevant decision maker can make decisions about this. They can be notified automatically, or they can see this information on a dashboard. And if that leave is approved or denied, the user gets notified. So it makes the process of getting users leave into HosPortal extremely easy. Work rules can be completely configured to your entire working environment. Here on the screen here, you can see a couple to just demonstrate what they might be called. So a bit like I mentioned, someone can't work more than 5 consecutive days. They mustn't work more than 80 hours per payroll period. And this has an FTE modifier. So for example, if someone's 50% FTE, then it will be 40 hours. This here is a screenshot of what the tool is for building these rules. You can see there's quite a lot of settings you can have, and this is only an abbreviated version. You can make as many of these as you like, and they can be extremely specific to particular things. The conflict rules, likewise, are completely configurable and you can have as many of them as you like. Here I'm showing a few. So two shifts on a particular roster need to be at least 10 hours apart. If you do a night duty, you can't do any shift on the next day, and none of the shifts can be overlapping. And again, here's an image of what our configurable rule builder looks like. So you can see there's a lot of options. You can filter by particular rosters, types of rosters, whether they have tags, whether they fall on particular weekdays, and you have a number of different ways of defining the relationship between the 2 shifts. We've talked about just purely hours apart or overlapping, but you can have specifications around falling on the same day, the next day, or this kind of thing. So I talked about patterns earlier, so you can define as many of these as you like. They can again be specific to the kinds of user or role of the person. This example here you can see is just a pattern saying someone should do 3 nights in a row. You can have some more complex patterns like Monday, Tuesday, Wednesday, Thursday night. You do night duty, then you have 3 days off, or you do Friday, Saturday, Sunday night, and then you have Monday and Tuesday off. In order to collect users' preferences, we have a workflow. I mentioned that this is optional. If you use auto build, you don't need to collect preferences or blockouts. If you do, then the workflow is designed so that the users will automatically get an email and SMS telling them to start to make their preferences, and also tell them when their time's up for making those preferences. They can preference a particular shift on a particular day, or they can block out particular shifts or entire days. This image here shows you a little bit of what this looks like for a user. So the panel on the left is something they can see that tells them some basic details of this self-roster period, when they've got time to do that, make those preference selections, how many blockouts they've chosen. On the right-hand side, you can see that this person has chosen, made their preferences, the beige blocks are their preferences. So they've chosen to preference every Monday and every second Thursday. And they've also blocked out one of the shifts on one of the weekends. It might be a bit small to see here, but when a user is making preferences, they can also see how many other users have preferenced particular days. This will help them get an idea of how likely it is they might get that shift, and it also allows them to perhaps choose shifts that are got less preferences, and therefore they're more likely to meet their particular preferences. So now we're going to look at our current algorithm, run through how it works and what the limitations it has. So this algorithm we've been using for 10 years. It's quite successful. It does a lot of things very well. It's a linear single path solution that doesn't break constraints. So it picks a random shift that's currently vacant. It gets the list of possible users to do this shift. In the first pass, that'll be users that have made preferences. In the second pass, any users that can do the shift without affecting any of the constraints. So for example, they're not on leave, they don't break any work rules, they haven't blocked out the shift, and so on. We then randomly choose a user weighted for how far they are from their quota. So the further they are from their required quota, the more chance there is they'll do this particular shift. Once that shift is filled, we repeat this process. But if there aren't any users who can do the shift, it has to be left vacant. So it always matches constraints. It works well for simple rosters. If there aren't any patterns and the constraints are relatively few, and we found that this has worked really well for private hospital on-call rosters, for example. And you can assess each of the results by looking at statistics that are associated with them. But it is a bit limited because it's a single path to the outcome. An early choice in that process might prevent later choices and better solutions. You can get around this by looking at the statistics, deciding if the result meets your needs, and run the algorithm again. It might produce better results, it might produce worse results, but it can't deal with situations where multiple shifts are related to each other like patterns. So let's now talk about what our AI does that's better and different. So what the AI does is it starts with the best guess and it scores this. It then makes changes such as moving users in and out of shifts or in and out of patterns. And then it recalculates the score. That score is compared against its current best result. And it continues this process. There are some tricky aspects to this. We're not going to go into detail, but essentially, the more time you give it, the better the result that it gets. And we'll be demonstrating that shortly. Effectively, we're building tens of thousands of repeated rosters, scoring them, and incrementally moving to the most optimum result, and then returning that. So how does that scoring work? Well, to start with, under most circumstances, the hard constraints aren't broken. So the ones we talked about, like work rule, leave, blockouts, the user doesn't get placed on a shift. We have particular penalties when there's a vacant shift or a user is under quota, and we have rewards for pattern matching and where a user's shift matches their preferences. So all of these are added together to make a score for a given roster at a particular time. As we're going to demonstrate a little bit later, the normal hard constraints can also be made a little softer. This is configurable, and you can configure a penalty if they're broken. So for example, the leave, the blockouts, and the rules can actually be made slightly soft and occasionally breakable in order to get outcomes that you want. I mentioned time as being important here. Like a human rosterer, the more time you give the AI, the more chance it has finding the most optimal result. Hence, you can decide how much time it can spend. As we're going to see, for the most part, this isn't particularly long, especially compared to how much time you probably spend building a roster. So now we're going to look at some examples of building rosters using the AI. I'll be switching backwards and forwards now between the PowerPoint slide and the Chrome browser. This Chrome browser is pointed to our demonstration site. This is actually our software. It's not a simulation. Some of the data, though, is simulated, and some of it is anonymized real data from some of our hospitals. We've done that to try and get, really high quality data, things where the constraints really matter. There's lots of leave, there's complex rules, so that you can see real results. The majority of these aren't going to be in real time, though, because as I said, it can take time. By that, I mean 5 to 10 minutes. So the majority of the results we're going to look at have been previously generated. The first one, though, I'm going to do right now, just to show you that it's real. So I trust you can see this browser here. So this is fake data. It's not real. It's a hospital that has 6 shifts on each day, and we will be doing I think it's a 3-month period. So over that time, there's 500 shifts that we're going to fill. We've also got some patterns with this particular one. We've got the patterns I alluded to before, so Monday, Tuesday, Wednesday, Thursday nights, and Friday, Saturday, Sunday nights. So what I'm going to do is start running that one now. And we'll go back to the PowerPoint and just go through that. So 2-day, evening and night shifts per day. We've got a work rule that says users can't do more than 80 hours per fortnight. There's these 2 patterns I've mentioned, and they are more than just the night patterns, but also days off afterwards. So if somebody does Monday, Tuesday, Wednesday, Thursday night, they then have Friday, Saturday, Sunday off. If they do Friday, Saturday, Sunday, they get Monday and Tuesday off. We've set this up so there's a significantly higher penalty for vacancies for night duty, and that's higher than evening and higher than days. So we'd expect if there are any vacancies, they'll mostly be in the day shifts rather than the night shifts. So we'll go back to the browser and see what's happening now. So typically with the particular settings I've given here, and we're not really going to go into the settings in too much detail, but I gave it 10 seconds for improvements in vacancies and a total limit of 20 seconds. So we'd expect within the next few seconds it should finish running. Trust me. Okay, there we go. So, as you can see, we've got 27 vacant shifts over the day and evening and no vacancies over the night shifts. As I said, we had around a bit over 500 shifts, 550 shifts. So 27% is only a small percentage. 27 shifts are maybe 3 to 5%. We can have a quick look actually at some statistics on that. So we've given this a grade of 97.5. This grade is thumbing all of the features of what we consider to be a quality roster. And we filled 95% of the shifts over 1 minute and 21 seconds. So we'll come back later to see how we can improve that with time. Just having a little look at that. So you can see a smattering of vacant shifts, predominantly in the days, but there's also some evenings as well, which is what we expect. I'm not going to sum them, but I can assure you that there would be probably half as many evening shifts that are vacant as day shifts. And then over here, we've got some statistics showing various people's quota and their associated drafts. And in this case, they're split between nights and the days and evenings. And if you glance here, you'll see this person's got a quota. They've all got the same quota. So actually 14 nights, 15 nights, 15 nights, 17 nights, 15 nights, very similar numbers. So again, the algorithm, the AI is doing its best to give people similar numbers of shifts. Now, this next one is real data that's been anonymized. It consists of a lot of preferences users have made and blockouts. Quite a number of rules around night shifts falling after day shifts, and users have leave as well. So we'll have a little look at that one. So just looking here, you can see the green are the preferences. So on a lot of these days, there's sort of 8 to 10 preferences, and then the dark blue ones are the blockouts, 20 to 30 blockouts on each day. And let's have a look at the roster that we got out of that. So these are you can see that there's quite a lot of conflict rules here. So these are mainly about making sure people have a gap between nights and days, but you can see there's plenty of them. And you've seen a number of preferences and blockouts. And if we have a little look at what was used to build this, this took 3 minutes for the AI to build, with 99% of shifts filled, and an 88% alignment of quota, with 50% of the shifts matching users' preferences. So let's have a little look at what that looks like. So if you see, the white shifts are shifts that have been filled matching the user preferences, and the tan ones are shifts that don't match user preferences. So you can see we certainly haven't matched everyone's preferences, but we've done a reasonable job of it. We can have a look at, and there's only 3 vacant shifts, which isn't very many out of 420. And if we have a look at the statistics here, this column down the side shows you how closely people's shift match their preferences. Now, this is a slightly complicated statistic because if users make a lot of preferences, so let's take this row here, this user has a quota of 2 for this particular grouping of shifts, and they've made 73 preferences. So it's quite easy to get preference matching under that circumstance. But this user down here with the same quota for the same group has only made 7 preferences, so 1/10. All the same, we've managed to get a 50% preference match. So that's quite good. Our next example is again real data. This is for a hospital that uses very complicated interlocking patterns to build their roster. And in fact, every shift, and there are 8 every day, is described by a pattern. So for example, we have a little look here. This is what I've annotated this roster to show you what this pattern looks like, or these patterns. There's a lot of them. So on the second column there, you can see the person who does the first shift of the evening does the 4th shift of the night. The person who does the 2nd shift of the evening does the 3rd shift of the night. The person who does the 3rd shift of the evening does the 2nd shift of the night. And the person who does the 4th shift of the evening does the 1st shift of the night. Likewise, on the right-hand side for the weekends, you can see a complex pattern where there's a total of 24 shifts done by 4 users, and they each do 6 shifts. And those 6 shifts are all described by a pattern. So you can see on the Friday, somebody does 2nd on call, followed by 3rd on call, first on call, followed by third on call, fourth on call, followed by first on call. So I think you'll agree that that's quite a complex undertaking to put all that together into a roster. Those of you who are here from that hospital, I'm proud of you for how much work you put in. But here is showing you what the pattern looks like built on our system. And then here is a quick view of what the number of patterns are that are used in this setup. So you can see there's, I think, a total of 20 patterns used. And down here you can see how many shifts there are. So over this 3-month period, we're filling 424 shifts using this. And then here we're going to have a look at how our AI did this. So it spent 11.5 minutes building this roster with 97% of the shifts filled. So if we have a look at what those drafts look like, so there's only 12 vacant shifts across these 424 shifts, which I think is quite impressive for these complicated patterns. And so those 12 shifts represent actually just 2 patterns, 1 on each weekend here. But all of the other shifts have been filled. So a very, very complicated setup for the AI to deal with. Now, I mentioned that time can improve results. And so that first one example we ran when we started showing the examples, we ran for 1 minute and 20 seconds. So that's this one here. So I'm just going to apply that so we can remind ourselves. So there, 1 minute and 20 seconds is how long it took to run, and it had 27 vacancies. Now, previously, I asked the AI to do exactly the same thing. So no changes to any rules, any structures at all, but spend more time on it. So I'll have a look at that now. This time we took 6 minutes to do it rather than 1 minute and 20 seconds. And now we've gone from 27 vacancies down to 3 vacancies. Now, that's not long, 6 minutes really, is it? It's the sort of thing you can just set the computer running, go and make your coffee, come back, and it's done. But I think it shows very powerfully how that time makes a difference. So there's a completely full roster. Now, this is the one we discussed before with the weeknight patterns and a few simple work rules. So that's 500 shifts filled very easily. Lastly, I'm going to demonstrate this idea of taking hard constraints and making them soft. And that's what a real rosterer sometimes has to do. A human rosterer builds a roster and they can't fill it completely. There are some vacancies that they can't get around. In this particular example I'm going to show you, we have a work rule that is users should not work 2 weekend days on the same weekend. So they should either work a Saturday or they should work a Sunday, but they shouldn't work both. Now, if we have a look here, this is a first running with that rule being hard. We've still got a pretty good result. This roster has 4 shifts each day, so just over 300 shifts over a 3-month period, and we've only got 2 vacancies. But you need to fill that. Now, you can do that manually if you want, but what you can also do is what I'm going to show you now, which is make that weekend rule slightly soft. So that by being slightly soft, I mean the penalty for breaking it is quite high. So that doesn't mean all of a sudden the AI is going to break it all over the place. It means if it can slightly improve the score of a given roster, it will do so. So this is what happens when you make it soft. So now we have no vacancies, and those 2 vacant shifts have been filled by a user. Now, these little alert icons are there because Brown here is working on Saturday and Sunday, and Iverson here is working on Saturday and Sunday, and that breaks a rule. So you can see that the rule's been broken, but now we have no vacancies. You could also do that yourself. So, for example, you could change, perhaps you want to do it manually. You say, I actually want it to be this person here. That person will still have a rule broken, but it's a different one because it's this person here, Evans, not Iverson. And you can do that yourself without using the AI. So we've gone through those examples. I'm now going to move on to just briefly talking about some of the future directions for HosPortal in coming months. The software that you've seen, we're going to be releasing in a matter of weeks. As you can see, it works. The one thing we really want to make sure we've got right is an interface that allows people to pull the levers, to change those constraints as they want and get the outcomes that they want. But I think you'll agree that it's pretty amazing in the things that it does today already without that user interface. So within a matter of weeks or so, that will be available for you to use. Following that, we're hoping to release our supervision module, which we preempted at our last webinar. This module is designed around our growing client group, which is junior medical officers. So this will allow you to specify with configurable rules who needs to be supervised. So that could be a particular roster, particular shifts on a roster, particular roles like interns or medical students. It could be just a particular user, somebody for who some reason needs to be closely supervised. It could also specify when that supervision is required. Maybe it's only need supervision on the weekend or supervision whilst on call. And you can be quite specific about that kind of thing. Could even be like Friday nights, Saturday nights. Then you can specify who's going to do the supervision. Is it anyone with a particular skill or role or belonging to a particular team, or is it a particular user? And lastly, what do those supervisors have to be doing while they're supervising? Do they need to be in the same room, in the same operating room or clinic as the person they're supervising? Is it good enough that they're in the same operating complex? Or maybe they need to be on call at the same time. Or maybe they're just a phone call away. They're not actually on any roster. And you can define all of those things. Our next feature will be our term preferences module. Again, looking at resident medical officers. And this will allow hospitals to collect preferences from users over which terms they'd like to do over a clinical year. And allow them to define those terms, and then allow those preferences for terms to go into our AI and build matching preferences as much as possible, much like you've seen with the auto build rosters, in order to create users on terms over a clinical year. Lastly, users of HosPortal will know that in recent months we've rolled out a very, very powerful reporting tool that allows you to build detailed reports of shifts that already exist on the system or even templates. But it doesn't allow for factors like meal breaks or other breaks. And we're going to be adding that in coming weeks as well, to the result being that reports should be more suitable to send to pay officers in order to pay staff. So that's it for my presentation this evening. Thank you very much for your time, and I'd welcome you to ask me any questions.